Hello and welcome to tuning into this short video on reflective practice, or specifically how you might use Gibbs' reflective model to inform your reflective writing. So why do we do this? What is this reflective practice and what is this reflective writing? Well, as you can see here, our experiences shape who we are, and our experiences on their own aren't often enough to show that we're actually developing and learning. We need to learn, or we need to demonstrate that we're learning from our experiences. So specifically in your degree, you need to show this. So your reflective portfolio should show your journey from the day you arrive with us to the day you leave, and then that'll stay with you throughout your professional practice. Gibbs' 1988 reflective cycle helps you do this particularly well, and it's the main reflective model that's adopted in healthcare. It's a 6-step process. You can see here that for the first 3 talk about what happened, and that's your description, your feelings and your evaluation. And the second 3 focus on how you can improve, and that's your analysis of the situation, which is your opportunity to bring in some evidence, your conclusion and your action plan. So just to help you frame this, in the first bit, the description, you describe what happened, who was there, what was going on, what did you do, what did others do, what was the outcome. Basically, it's a summary and a snapshot of what lies ahead. If you wanted to, you could ideally perhaps bring in the opportunity for some evidence here. If it was, for example, it was a clinical moment and you were talking about hip osteoarthritis, you could start talking about the national guidelines, the NICE guidelines. And maybe that was the framework for this reflection, because perhaps something went exactly how you thought it would and you admired the way it was delivered, or perhaps it didn't go quite the way because the person who was maybe a clinical mentor was maybe talking about wear and tear, or was talking very negatively to the patient, and you didn't feel this really fitted with your delivery of the model. So basically that description is that first summary. The feelings is the summary of your opportunity to really show who you are in this situation. What were you feeling during? What were you feeling before? What do you think other people were feeling? How do you think they were approaching it? This is where you're starting to demonstrate your self-awareness. And you finish off by saying, what do you think is going on right now? The second part of this, or the third part of it, is the evaluation. What was good and bad about the experience? Because not all reflections are on bad experiences. So what went well and what didn't go so well? And how did you contribute and what did others contribute to that situation? Then we move on to the analysis, conclusion, the action plan section, the second part of it. So this is where you're really going to show how you're picking something apart. You're really demonstrating your critical thinking, your professional status. So why didn't it go well, or why did it go well? And what sense can you make of it? What knowledge, either your own or others, and this is where literature can come in to support your ideas, what knowledge can help you understand the situation better? This is a great opportunity. So let's say we're talking about subjective history taking. There is an awful lot about how a good clinician can lead a conversation, but without getting too involved or using the language that sort of triggers negative thoughts in a patient, how you can ask more open questions that encourage the answers, and how you can actually get the patient to motivated to buy in to their own sort of recovery process and bear some responsibility. There's so much written about that. When you see it in practice or you don't see it in practice, this is an opportunity to say, well, this is what I'll do in the future, and here's the evidence to support it. The conclusions are, what have you learned? What could be maybe more positive? How we could have improved that situation. Was there a moment in time where you felt that you could have added something, or maybe you shouldn't have said something? Or was there a moment in time where, in a great situation, when you thought you made that contribution, or you saw somebody else step in and ask the right question or make the contribution that really improved the outcome for the patient? What else could have been done if it's a situation that requires a bit of improvement? And then finally is the action plan. If you had to do the same thing again, what would you do differently? How will you develop the required skills to manage this situation in the future? Or how will you take those skills that you've clearly already obtained, or you're developing further? How will you push them on into applying it more widely? Can you show that from a previous experience you've brought that experience and that skill forward? And what would you do differently, or what would you reinforce next time? So again, everything needs to be articulated in a way that really shows your development, that shows you on a journey, and that you're recognizing and becoming self-aware of your own sort of performances, skills, abilities, and that you are using the wider literature to support your progression and your development. So I hope that makes sense. I hope that gives you a framework to work in. These can be in depth and they could occupy 500 to 1,000 words, or they can be very short and snappy. It depends on the situation. It depends on the goal of the reflection, really. Maybe some positive ones could be shorter, but equally you can develop a long sort of extract for that for various assignments that you might have to submit. I hope that was useful for you, and thank you for listening.